Hi, my name is A. I'm a second-year medical student. May I ask for your complete name, please?
My name is Romeo Manuel Castillo Ilagan.
Okay, thank you. I will be conducting a cardiovascular physical examination, and everything will be video recorded. Would that be okay with you?
Yes.
Okay. May I ask for your signature as proof that you are giving your consent for this said activity? Before we proceed, do you have any questions or clarifications?
None, sir.
I will begin by measuring your jugular venous pressure. This will provide us an important index of right heart pressure and cardiac function. And in assessing if there is elevation of fluid volume, or if you possibly have acute or chronic heart failure, tricuspid stenosis, chronic pulmonary hypertension, cardiac tamponade, and other heart abnormalities. We'll be assessing your pulsation in your right internal jugular vein, since it is directly in line with your superior vena cava and your right atrium. I will be using a light to help in finding your internal jugular venous pulsation. Once I identify the highest point of pulsation in the right jugular vein, I will be placing a ruler to measure the vertical distance above the sternal angle. This will then be your jugular venous pressure. Do you have any questions before I proceed?
None.
Please lie down. I will have to let you lie down comfortably at about 30 degrees angle with your head slightly turned to the left. Please calm down. Okay, slightly to the left. Please turn your head slightly to the left. Okay. Your jugular venous pressure is 2 cm, which is normal. If it's above 3 cm, it is already considered elevated. I will now examine your carotid pulse to assess any decreased stroke volume from myocardial infarction, cardiogenic shock, or aortic regurgitation. Yes. I have not noticed any small or thready or weak pulse. I will now begin physical examination of your heart. I will begin by inspecting for any deformities, discoloration, and look for any your apical ripples. Okay. I will now palpate for heaves and lifts using my palm. This will help us assess for any large right or left ventricle of the atrium. I have not noticed any heaves or leaps. Next will be palpation for any thrills using the ball of my hand to assess any turbulent flow of blood in your heart. Okay, there's no buzzing or vibratory sensation. Next is palpation for your apical impulse. This represents the brief, early pulsation of your left ventricle as it moves anteriorly during contraction and contacts the chest wall. Can you please roll to the left, please? Okay, you may now rise apart. I will now auscultate for any abnormal heart sounds and murmurs. I will begin from the apex to the medial, then medially to your left sternal border, and then moving superiorly up to the second interspace, then across the sternum to the second interspace at the right sternal border. First, using the diaphragm of my stethoscope, this is the diaphragm, then I will be using the valve. Okay. Okay, I have not noticed any unusual heart sounds or murmurs. Okay, now that we're done with your cardiovascular examination, I will now palpate for your popliteal pulse to assess if you are experiencing popliteal artery aneurysm from atherosclerosis. I will place the fingertips of both my hands midline behind your knee and will press it deeply into the popliteal fossa. There's no exaggerated or widened popliteal pulse. I will now palpate for your dorsalis pedis pulse located at the dorsum of your foot just lateral to your extensor tendon of your great toe. This will help us assess if you have any peripheral arterial disease. Okay, I was able to palpate your dorsalis pedis pulse. I will now palpate for your posterior tibial pulse located slightly below the medial malleolus of your ankle. This will help us assess it for acute arterial occlusion. Do you feel any pain or numbness or tingling?
None.
I will now palpate for your brachial pulse, which is located at the bend of your elbow, just medial to your biceps tendon. Can you extend your elbow for me, please? Okay, thank you. There's no any abnormal or noticeable abnormalities in your pulsations. I will now perform Allen's test to compare patency of your ulnar and radial arteries. This test helps us assess for any arterial occlusions. Can you make a tight fist, please? Please open your hands. Okay, let's do it again. Can you please make a tight fist? Please open. Okay. Failure in your hands is not persistent, sir. Everything's normal. There are full pulse gradings. First is the bounding, which is a +3, and next is the brisk or expected, which is a +2. The third one is diminished or weaker or than expected, which is a +1, and 0 is absent or unable to palpate. So bounding, carotid, radial, and femoral pulses are present in aortic regurgitation, which we didn't find during my assessment a while ago. Asymmetric diminished pulse point to arterial occlusion from atherosclerosis or embolism, which is also normal in assessing your pulsations. So everything's normal. Any questions or clarifications?
None.
Okay, thank you very much, Romeo.
Thank you, sir.